2012 EORTC trial is a randomized trial comparing doxorubicin single agent versus a combination of doxorubicin and high-dose ifosfamide in first-line treatment of advanced soft tissue sarcoma. The different trials which were addressing this question beforehand were addressing the question using a type of regimen which was probably suboptimal in terms of combination. So the people were asking themselves, the trials were negative, but were they negative simply because the combination that we used was suboptimal, yes or no? And should there be something here? So the question which was addressed, which was supposed to be the final question, let's use the optimal high-dose chemotherapy, ifosfamide, doxorubicin regimen versus standard doxorubicin regimen, and let's see whether there is an advantage in overall survival, which is the primary endpoint of this study and a crucial endpoint for cancer patients, of course. It showed that the primary endpoint, overall survival, was not different between the two arms. No significant difference in overall survival between the two arms. That was the primary endpoint. So the study is negative in a way. Doxorubicin single agent remains the standard treatment. Secondary endpoints are very much of interest, however, because there is a clear improvement in progression-free survival in the combination arm. There is also a clear improvement, more than double, increase in response rate in the combination treatment, and also a very significant increase in the toxicity in the combination treatment. But all this happens at the expense of no improvement in overall survival. If your aim is to try to induce a response, to reduce tumor volume, you should probably be using the combination treatment. And this may happen in about 10% of the patients with advanced soft tissue sarcoma because you intend to resect the patient, for instance. But in all the patients, doxorubicin is the standard treatment. There have been discussions and debates in the last 30 years all over the world on what should we do in first-line treatment. And some advocate doxorubicin, others advocate doxorubicin and ifosfamide. And now, after this final trial addressing this question, because I think the question is now final, we can say that doxorubicin remains the standard as single agent for the majority of patients. And in few patients in whom we have the need for reduction of tumor volume, then the combination could be used at the expense of increased toxicity. It will be of interest for the future to evaluate what is the impact of the combination treatment, maybe in selected histological subtypes, maybe in selected molecular subtypes, and this will be analyzed in the future, and I hope we will have additional results on this question for the years to come.